Well, as we know, UTIs are likely caused by a dysbiosis or dysregulation of normal flora. Culture doesn't give us a complete picture. And what about the patient who has persistent symptoms on antibiotics? They're often culture negative because the bug, let's say, is getting treated, but what if that bug develops resistance and it is there and it's causing pathology or cystitis, but is not actually identifiable by culture? So that's where next generation sequencing provides diagnostic value. But I want to add a couple because it didn't say specific that we must focus on simple cystitis. I'd like to include some other important UTI scenarios where it's very important. So one is catheter-associated UTIs. There has been identification of uropathogens in biofilms that are associated with catheters and stents, where a biofilm is where the bacteria have actually become present in a safe space, which is in this biofilm that's often adherent to catheters and stents. So next generation sequencing has been used to characterize multi-species biofilms, which might be missed in culture. Now, what's also important, and I think there's a critical role, is in stone management. And what we see is, and we've seen that we have 3 stone experts as well as other providers who treat stones in our institution. They go by the guidelines, treat with antibiotics, patient's not febrile, and then they do a stone procedure and the patient gets septic or very septic. And if we had had this ability, because maybe they were culture negative, but there were obviously bugs that were sitting in the stone, well, if we could detect this kind of bug through the DNA in the urine of these patients, we could prevent sepsis episodes. One thing I just want to show this head-to-head comparison, which actually showed, this is in cystitis, that only 30% of the samples that were DNA positive were culture positive, which shows that the DNA is more sensitive. And the patients did have improved treatment outcomes in the next generation sequencing group. What is important, though, and I think I mentioned that earlier, is that we didn't really look at the asymptomatic group and what the difference was in those patients. Cost. Now, aerobic culture is cheaper, but if you start adding aerobic, anaerobic fungi, it's actually $300 more expensive. And MicroGenDx, which is one of the 2 large companies that have developed this technology, MicroGenDx has received approval from the AMA and CMS with their own reimbursement code, so now it's covered. One interest of mine is whether or not interstitial cystitis is due to bacteria. Why would someone, 5 to 10% of the IC population, have the development of ulcers? And we actually have, as part of the MAP network, ongoing studies to look at that. Is there a bug that's creating ulceration that we're just not capturing? The patient who has a UTI that's culture negative after you treat with antibiotics, but there's symptoms persist sometimes for months. That's a perfect opportunity to study whether or not treatment based on NGS is warranted. And we're actually participating in a study right now through MicroGenDx. Fertility, Dr. Shea's involved in a study looking at semen. Maybe idiopathic infertility is not as idiopathic as we thought. Stricture disease, this is through with Dr. Buckley, and also Dr. Shea's doing a study of infections of IPs and using next generation sequencing to tailor antibiotics. In conclusion, next generation sequencing offers a comprehensive scope of the urinary tract microbiome. It is I think the up and coming, and is going to revolutionize and already has revolutionized our treatment in urinary tract infections. And we hope that will also help us manage better and learn more about other conditions like stone disease, infertility, and IC.